On this week's episode, Dr. Mike and I talk about how to heal your neck pain. And this week I'm here with Dr. Mike and we're going to talk about neck pain. We talked about various forms of neck pain. We're just going to talk just in general about it. Dr. Mike, how does neck pain present itself?
It can come on in many different ways, and so it can be as simple as someone just coming in and saying they slept wrong, they got a little kink in their neck. A lot of times they'll come in, they'll like, I can't turn and see in my car, trying to look behind myself, so we're looking at kind of a loss of range of motion. Everybody's range of motion is different, and what we really look for is symmetrical motion. So normally 80 to 90 degrees is normal, say for like neck rotation. Yeah, going both directions, and not everybody gets 80 to 90 degrees, but as long as it's equal from side to side, that's kind of what we're looking for. But if they can turn really well to one side, but they can't look, say, so well over one shoulder, that's when they'll typically come in with that. A lot of people that come in just tension, tightness through the neck and the shoulders. Numbness, tingling in the arms, the hands, the fingers, it could be another manifestation of it. Really pretty much about anything. Bad posture can contribute to it, which we see very typically, a lot of state workers here in Springfield. We see quite a bit of that, individuals that sit at a desk 8-10 hours a day, so just that bad positioning, 5 years, 10 years on the job, 8-10 hours a day, it adds up.
It definitely wears on you after a while. And I know we've covered desk ergonomics in other videos. Make sure you check that out on our YouTube channel. How does neck pain occur? How can it happen?
It can come from so those chronic, constant, repetitive stresses, like I was just talking about, sitting at the desk for years and years and years. This kind of a positioning, head forward, what we call anterior head syndrome, could be one way it can happen. Two could be injury, whether it was an injury from the time that you were born, from one time that you were a kid, or you get into a car accident or a sports injury. Think about kids spearing each other in football. That could be a neck compression type injury. Those are pretty much the two common ways that we do it. And you can think of any injury, any trauma that occurs that can cause an issue with the neck, or those chronic repetitive stressors.
And how do we treat it in the office?
So first and foremost, I've said this numerous times, our primary focus in the office is chiropractic. So that's the adjustment itself, figuring out where the subluxation exists, the lack of motion within the spine, making that correction. That's first and foremost. We have a massage therapist here in the office that can help deal with muscle tension, muscle stress that goes along with that. We can do laser, we can do Graston, we can do electrical stimulation, which we'll talk about in a little bit later segment. We can do traction. Any number of facets and ways that we can deal directly with that neck complaint or neck issue.
And I guess it's kind of hard to estimate how long each treatment would take to relieve that neck pain. It's depending on person to person. Person to person,
but then also chronicity. So if, say you've never had neck pain in the past, you wake up this morning, you have a kink in your neck. Typically that will respond faster than a 50-year-old individual that's had neck pain for 30 years. Based on the acute nature or the chronic nature of the problem is going to determine, to an extent, how long that process will take.
Sure, that makes sense. All right, Rainie's Fitbit is actually up next. She's going to cover why you should try to avoid self-adjusting, and then we're actually going to show the
electrical stimulation.
Yes, and benefits of that for neck pain.
Hi, I'm Rainey. Welcome to the Fitbit of the Week. This week we're talking about neck pain. So my video today is basically for those of you who have the habit of self-adjusting or popping your neck on your own. And I just want you to know that can be dangerous. You might be putting your neck in a worse position or just like making the pain worse. So we don't want to do that. So instead, what you should try doing when you feel that need to pop your neck, maybe it's like a stressful situation that you're in, you have the habit of doing it then. Maybe you are feeling tension or pain and you feel like you need to do it then. In any of those situations, just go ahead and stretch your neck. So what you're going to do is just take your head to the side so that you're stretching the muscles that run down the side of your neck in both directions. Maybe take your nose at an angle so you're feeling the stretch a little bit more towards the back of the neck. Again, if you have a lot of tension, you're going to feel these stretches a lot more. And then the second thing that you should do is something called chin tucks. What those are is you're just going to press your chin forward and back and forward and back. Just do 20, 30 reps of that. You're gonna feel the stretch in the front of your neck and in the back. You may hear a little bit of crunching or like popping noise, but that's okay, because you're just kind of moving your neck, stretching those muscles, and hopefully those both stretching to the side and forward and back will help relieve some of that tension, maybe help with that pain that you're having. But then again, make sure you're getting adjusted by the chiropractor and trying not to do it yourself. So that's been this week's Fitbit, and we'll see you next time.
So we're back with Dr. Mike, and I know Rainey talked about the dangers of self-adjusting. I kind of want to ask Dr. Mike your opinion on it.
So the first two things that I ask any patient when they come in and they tell me that they self-adjust, whether it's once a day or multiple times a day, it usually comes down to a habit. So it starts off because something's uncomfortable, something's painful, and then it becomes habit forming to where every 30 minutes to an hour they're doing it again. Mm-hmm. And so a couple questions that I always ask those people, and it's kind of a smart aleck response, but one is, how much school did you go to learn how to do that? Typically the response is none. Yeah. And then second is, if what they were doing was working, was helping, would they be in my office today? And the answer once again is always no. They're creating an instability in those joints. What it does, it makes our job a lot harder, and it makes their progression through care a whole lot slower. And so if they're constantly sending information, input into that nervous system, the body's just gonna pick and choose what it wants to do. And so the adjustments that we make that need to be made never get fully corrected because they're going in and they're screwing up everything either above it, beneath it, in the same area. So yeah, so I always talk about, don't do it, stop doing it, just be conscious of it. Because even if you do it then, at least in your head you're gonna say, oh, they told me not to do that, I shouldn't do that anymore. Then you can break that habit cycle.
Mm-hmm. Good point.
Yeah.
And so next we're gonna talk about
electrical stimulation.
Electrical stimulation.
Yeah.
I keep forgetting what it's called.
Yep, electrical stimulation.
How does it work?
So we use these little pads, and we take the pads and we surround the area of concern. And so say in your case, your issue was the middle part of your neck on your left-hand side. With the pads, what we're gonna do is we're gonna place them above the area and below the area of concern. Reason being is that when we put them, all four of them down, it's gonna work everything kind of in the middle of that.
Okay.
What we're doing is activating the muscles, and so whenever we have a joint injury or issue, the muscles around the area are gonna tighten up, stiffen up. What we're trying to do is decrease some of that muscle tension. We always put an ice pack on top of it as well. That's gonna help to decrease some inflammation, and we're just trying to get a little bit more relief, relaxation into those muscles to help the area move and function a little bit better.
So what about I've seen those for at home, like small take-home kits. People put pads on.
Yep.
What are your thoughts on that?
They have their place, I would say. They're called TENS units, so the frequency at which they work is usually a little bit different than what we use. But regardless, the concept is very, very similar. What I tend to find, just from patients talking about them, is that they are greatly overused. So when we do a treatment with the stimulation here in the office, we do anywhere from 10 to 15 minutes maximum. Those TENS units allow you to use them up to 60 minutes at a time. Far too long. What we can actually do is create some instability. So if we relax the muscles too much, we actually create some instability in that area. A joint gets injured, muscles around the area will tighten up. And so that reason for that is they want to prevent motion. If you had full motion to that joint, you could potentially injure it further. So if you go in and you relax those muscles for 60 minutes straight, you could create some instability, actually set yourself up for some future injuries or re-aggravations of the current injuries. So
try to avoid, or if you're doing it at home, definitely don't go for the full 60 minutes.
Yes.
And not as continuous.
Yep. Yeah, exactly. So
yeah.
I go along with the same recommendations that I give for icing at home. 15 minutes on, leave it off for the duration of an hour, and then you can repeat from that cycle on.
Okay.
Yep.
All right. So I'm going to actually put it on my neck, and we're going to show how this therapy works.
Yep. So face down.
All right.
So like I said, we're going to surround the area of concern, and so we're going to go 2 pads above whatever our area of concern is, and we're going to go 2 pads beneath our area of concern. And whenever I'm talking to a new patient about this, I always ask them a couple of questions. So as we put them on, as we start turning it up, what I'm going to tell them is that you're going to feel, initially what you're going to feel is just a little bit of a tingling sensation. And so, Brooke, I want you to go ahead and tell me when you start feeling a little bit of a tingle in there.
Okay. All right.
Okay, so now the next question or the next thing I always tell them is I want you to tell me when to stop. So when you feel it working okay, but it's not painful or uncomfortable. If you're white knuckle grabbing the table because it's so incredibly intense, obviously it's not going to do the job that we're looking for. And so as I hit the start button, what it's going to do is going to bounce around through these pads. And so she'll feel one of them activate, another one activate, and kind of moving around. And like I said, we're treating everything kind of in the middle portion of that. Normally, I'd put an ice pack on as well, whether it be kind of through the neck, through the upper back, based on where the primary area of concern is, but we're treating everything in that middle section there.
So I'm done with my treatment, and typically a treatment takes how long?
10 minutes is where I put most people at on this. Some people, if they've been in for a while and we just kind of figured a couple more minutes is a little bit more beneficial, up to 15 is about the max that we would do.
And it feels great.
Yes.
Yeah, it really does. So hopefully this episode was helpful for any of you that are suffering from neck pain. If you are, make sure to call our office, get in for an appointment. We will see you next week.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.